I'm Erin Myles, and my scholarly project is the reduction of adverse events in pediatric surgery patients. Abstract. Anxiety is a major challenge pediatric patients experience in the hospital setting. Children often feel anxious in the hospital setting due to a sense of helplessness, unfamiliarity, and lack of control over their environment. Anxiety left untreated can lead to delays in medical treatment and cause the patient to suffer trauma that can have lasting effects related to anxiety, depression, and behavioral problems. Currently, patients with anxiety are often given medications or sedatives to decrease this feeling. Unfortunately, sedatives are not always effective in reducing anxiety and can result in adverse events postoperatively, such as emergence delirium and agitation. The goal of this project is to help reduce the number of adverse events experienced postoperatively using non-pharmacological interventions. The research question guiding this project is, in pediatric surgical patients, is the use of non-pharmacological strategies when compared to the use of pharmacological agents more effective in reducing adverse reactions such as agitation and emergence delirium? The non-pharmacological interventions include guided imagery, distraction, music therapy, and age-appropriate education. And for this study's purpose, the pharmacological interventions include oral Versed. Introduction. The purpose of this project is to reduce the occurrence of adverse events experienced postoperatively. The intervention includes the comparison of non-pharmacological interventions versus pharmacological interventions to determine which is associated with more events postoperatively. By decreasing anxiety through non-pharmacological interventions, the goal is to reduce unnecessary administration of medications given to decrease anxiety. Although quick-acting, sedatives do not always reduce anxiety effectively. Non-pharmacological interventions provide effective therapeutic teaching and play to reduce anxiety in patients as well as families. In addition, patients that work with these interventions often have better experiences, which translates to improvement in attitude and behavior during future visits. Previously, there were no nursing interventions in place within the organization to determine the effect of non-pharmacological versus pharmacological interventions on patient outcomes. The researcher of the project noticed an upswing of emergence delirium and agitation in postoperative patients. This warranted the researcher to review the type of intervention the patient received preoperatively. The researcher found often the patient who experienced adverse events postoperatively received pharmacological intervention, specifically oral Versed, preoperatively. Specific aims. The short-term goals of the project include improving staff understanding of project vision and purpose, reducing adverse events experienced postoperatively in pediatric surgical patients, and improving staff engagement in providing non-pharmacological intervention to patients preoperatively. The long-term goals of the project include increased use of non-pharmacological intervention to decrease risk and rate of the adverse events postoperatively. In addition, by increasing the use of non-pharmacological interventions, patients will have a better understanding of the surgical process through the use of guided imagery, play therapy, and age-appropriate teaching. In addition, improved cooperation can be seen pre- and post-operatively. Both the short and long-term goals of the project will lead to improved patient outcomes as well as improved patient and parent satisfaction. Methods. The study was completed in a 200-bed pediatric hospital located in the Midwest region of the United States. The hospital is a nonprofit organization associated with numerous specialty care, primary care, and medical clinics. The same-day surgery and post-anesthesia care units conduct around 60 to 70 surgeries a day. The patients included in the study were seen in the same-day surgery unit and were not previously admitted on inpatient units. Although the use of pharmacological interventions preoperatively have not been an issue for the facility, the use of non-pharmacological interventions has reduced the number of adverse events experienced postoperatively, which has resulted in shorter patient stays, decreased use of sedating medication, as well as medication given postoperatively. It has improved patient outcomes and improved patient and parent satisfaction. After obtaining IRB approval, data collection and review of the electronic medical records was completed. A retrospective chart review was conducted, and therefore no formal education was provided to the staff. Informal education was provided to child life specialists as well as the pre- and post-operative staff members related to project design, purpose, and desired outcomes. Ethical considerations include protecting patient information and data related to the study. All patient information and identifiers were removed from data collection, and all data collected was stored on a locked computer in the Quality Improvement Coordinator's locked office. No informed consent was required because there is no interaction with patients for the retrospective chart review. No conflicts of interest occurred because the data was collected retrospectively. The EMR was used to determine intervention type, patient outcomes, and if an adverse event occurred. If no exclusion criteria were met, the following data was recorded. Did the patient receive an intervention preoperatively? Did the patient receive pharmacological or non-pharmacological interventions? Was the proper EMR documentation of the intervention type? Did the patient experience an adverse event postoperatively? And was the adverse reaction documented correctly in the EMR? Data collection. Each medical record was assigned a numerical number on the data collection sheet. All patient identifiers were removed. The data collection sheet was stored on a password-protected computer that was in the researcher's locked office. The author of the project and the QI coordinator were the only individuals with access to the password as well as the office. The data collection instrument used was the Pediatric Anesthesia Emergence Delirium, or PAED scale. The tool assesses the following. Does the child make eye contact with the caregiver? Are the child's actions purposeful? Is the child aware of his or her surroundings? Is the child restless? Is the child inconsolable? This tool is used to assess if the patients in the postoperative phase experienced agitation or emergence delirium. The use of the PAED scale is current practice in the PACU and is completed every 15 minutes. The data from the assessment tool was compared against which patients received non-pharmacological versus pharmacological intervention. The data was then compared to determine which intervention strategy was associated with the lowest occurrence of emergence delirium and agitation. Analysis. All the data collected for this project was analyzed using SPSS statistical software with the assistance from Maryville University's statistician, Dr. Pauls. All data was included, and no adverse events occurred that would alter data values. The project was a retrospective quantitative research design that utilizes a pre- and post-intervention design to determine which strategy, pharmacological or non-pharmacological, was more effective in reducing adverse events postoperatively. The data collected included all information regarding non-pharmacological and pharmacological strategies that were used preoperatively, as well as adverse events occurring postoperatively. The data collected from the electronic medical records was used to evaluate the interventions and outcomes. The research collected evaluates the effectiveness of non-pharmacological versus pharmacological strategies in reduction of adverse events postoperatively, such as agitation and emergence delirium. The inclusion criteria included all pediatric patients aged 2 to 17 years of age undergoing a procedure in the same-day surgery or post-anesthesia care unit. The exclusion criteria excluded patients over the age of 18, non-English speaking patients, patients are already admitted to an inpatient floor, and any patients with a contraindication or allergy to oral Versed. Results. Nominal data was transcribed using an Excel worksheet. The researcher created an Excel worksheet to display the results collected from the EMR review between the dates of November 14th, 2022 through November 18th, 2022. The EMR review was essential in determining the intervention type and patient outcomes, such as adverse reactions experienced postoperatively. A list of patients undergoing surgery through the same-day surgery unit were obtained from the Quality Improvement Coordinator. The data collected was placed into SPSS to evaluate the statistical significance between intervention type and adverse events using the Z-test difference between two independent proportions. The retrospective chart review consisted of a sample size of 254 pediatric surgery patients total. The non-pharmacological group had a sample size of 144 patients and 22 adverse events were experienced. The pharmacological group had a sample size of 110 patients and 38 adverse events were experienced. Outcomes of the retrospective EMR evaluation of preoperative intervention on postoperative outcomes noted a reduction between non-pharmacological interventions and adverse events occurring postoperatively. The ratios were statistically significant, p equals 0.05, when comparing non-pharmacological versus pharmacological interventions associated with adverse events. The data trend shows a statistically significant shift in the number of adverse events experienced with non-pharmacological versus pharmacological interventions. When comparing data for each intervention type, the non-pharmacological interventions yielded a 19% reduction in adverse events experienced postoperatively. Discussion. The pharmacological intervention group sample size was 110, resulting in a proportion of 0.35. The average proportion is 0.24. There is sufficient information to suggest a decrease in the ratio from pharmacological to non-pharmacological intervention. The achieved power of the study is 0.97, which is considered strong. The confidence interval suggests a true change in the ratio from pharmacological to non-pharmacological intervention. Since 0 is not included with the interval, we have significant evidence to show a change in one direction. Although no additional data collection was done to determine statistical significance, patients with less adverse events also experienced less medication costs, fewer complications in the postoperative stay, shorter postoperative stays, and improved patient satisfaction and outcomes. Implications for nursing practice. Non-pharmacological interventions can be used to reduce pain and anxiety, as well as improve cooperation and understanding in pediatric surgical patients. In a recent study, researchers compared the use of tablet-based interactive distraction and oral Versed on preoperative anxiety, postoperative emergence delirium, and length of stay in pediatric surgical patients. Patients undergoing surgery were placed in either the tablet-based distraction group or the oral Versed control group. Once the intervention took place, patients were assessed preoperatively for anxiety and postoperatively for emergent delirium as well as PACU length of stay. The study found the tablet-based distraction group was more effective in reducing anxiety preoperatively and emergent delirium and post-anesthesia length of stay when compared to the oral Versed group. These results align with the scholarly project findings, which report a decreased association between non-pharmacological interventions and adverse events. The success of non-pharmacological interventions in reducing adverse effects postoperatively can be translated to various units throughout the hospital. These techniques can be used to improve patient outcomes in different units of the hospital, including, but not limited to, the emergency room department, radiology, and inpatient units. Another study analyzed the use of non-pharmacological interventions in the emergency room during IV placement in pediatric patients. The study compared the use of Buzzy, which is a vibrating bee that cools injection site area, virtual reality, distraction cards, and a control group. And the control group received no intervention. The study used the visual analog scale, the Wong-Baker facial scale, and the Children's Fear Scale to determine which intervention type improved pain and anxiety scores the most. The results of the study showed that the Buzzy was associated with the lowest visual analog, faces, and Children's Fear Scale scores, followed by virtual reality, then distraction cards, and then finally their control group. The non-pharmacological interventions showed a significant improvement in pain and anxiety scores in pediatric patients undergoing venipuncture in the emergency room department. These techniques are effective in reducing anxiety and pain, as well as promoting cooperation and understanding. Discussion and presentation of the study findings could also be useful in motivating staff to implement non-pharmacological interventions before pharmacological interventions. Implications for future research. Future research can be conducted in areas that could benefit from these techniques, such as inpatient units, radiology, and the emergency room, to determine if they're as successful as they are in the pediatric surgery population. Non-pharmacological strategies can be used in all types of patients undergoing imaging procedures, obtaining vital signs, undergoing IV insertion, or laceration repair, and much more. Future research can also collect data regarding anxiety scores as well as pain scores to determine if non-pharmacological intervention is effective. And we can also collect data regarding patient outcomes and financial impacts, such as length of stay, postoperative complications, and cost of medication. Conclusion. Study findings concluded that the non-pharmacological interventions reduce the occurrence of adverse events postoperatively. The use of non-pharmacological interventions can help pediatric patients better understand the surgery process. These interventions can be useful in all different areas of the hospital as well as clinic settings to help patients better understand what medical visits will look like. As this practice is used more frequently, knowledge of the subject can be improved and new practices can be created to benefit our patients and families. When working with the pediatric population, it is important to create a safe and comfortable environment. One negative healthcare experience can cause a child to view all medical visits poorly. As healthcare providers, it is essential to promote a safe and comfortable environment for patients so they have a positive view of healthcare throughout their lives. The incorporation of non-pharmacological interventions can help a child understand what they are experiencing and motivate them to be more involved in their healthcare decisions for the remainder of their lives. Here's my scholarly project poster presentation that sums up many of the main points I addressed in today's presentation. And here are my references. Thank you for listening to my presentation, and please let me know if you have any questions at all. Thank you.